All right, so welcome back everybody to the monthly AVH webinars where we try to support each other with cases and philosophy and postology and some great info. And today we have one of the AVH board members presenting about exceeding average life expectancies with homeopathy. So, Dr. Ramirez, do you want to get going?
Yeah, sure, Jeff, thanks. I will start talking to you guys about a case I had in 2016, and it's related with a Cocker Spaniel. I want to start with talking about the congenital problems in the American Cocker Spaniels. And what we can find are some health problems related with this breed. The most or the main problems we can find in this breed are progressive retinal atrophy, cataract, patellar luxation, glaucoma, elbow dysplasia, gastric torsion, epilepsy, and other ones are cardiomyopathies, ectropion, urinary stones, otitis, hip dysplasia, hypothyroidism, seborrhea, phosphorus fructokinase deficiency, entropion chariae, liver disease, allergies, and congestive heart failure. And most of the average life expectancy is around 12 to 15 years. So this case I'm going to present you. Well, first, I want to talk about some statistics I could find in Latin America, and I found this picture very interesting because I could find a lot of information related with this breed in Europe and United States, Canada, but not a lot of information in Latin America. So I could only find one article who is done by a group of veterinarians who work hardly with that made a group for only cardiac troubles. And maybe you cannot see very well this presentation because it is not very clear. I will try to show you the most important parts here. Please ask me or tell me if I'm pronouncing in the not right, in the not proper way, because English is not my first language, as you may notice. So in the upper part of this table, we can find all the small breeds and what we can find related with sex. The small breeds, sorry, the females are less affected with cardiac troubles than the males. And among the breeds, we can find the mostly affected breeds are the Pekingese and the Dutch hounds. And the Cocker Spaniels, it's around 4.5%, which is the purple part of the pie. And the troubles with the heart start around 8, and the peak we can find it at 12 years old. In the bottom of this graph, we can find the bigger breeds. And this graph shows the opposite. The males are much more affected than the females. And as you can well, I don't know if you can see properly the information here, but the most affected breeds are the German Shepherd and the Doberman. And the average presentation starts around 7, and the main problems are around 9, 10, and 11. So that's the information I could find in Latin America. And the case I want to present you, it's this female mixed American Cocker Spaniel, and her name is Reina, who means the queen. This dog was presented on May 14 on 2016 because she ate some flowers. And a remedy was given, and this dog recovered very well after the first remedy. And after that remedy, the owner decided to treat this dog homeopathically. All the complaint, all the complaints this dog was having at that time. So I will give you a lot of general history about this dog. Reina is a young dog who was diagnosed with heart murmur when she was around 3 months old. At the age of 1.5 years, she had her first heat cycle, and ran away to mate. The owner did not want the pregnancy to continue, so she she didn't. The veterinarian applied allicin, which is a hormonal application for the interruption of pregnancy. And this injection caused a severe mammary gland inflammation that was treated allopathically and was partially resolved. 1 year later, she had a plant poisoning that was treated with belladonna 30C, 1 liquid dose, and was a very successful treatment at that time. And that was when the owner decided to treat her constitutionally. What we saw in Reina physical exam, the primary condition was the heart, the urinary problems, the hormonal disorder, and the skin problems. The current symptoms we saw was a heart murmur, the dribbling urination, the skin discoloration, the itching, the eczema, and the mama was swollen. It was related with the hormone applied in the past because this hormonal injection can be applied subcutaneously or it can be applied in the inner part of the legs, and that was the main problem that happened with this dog. The dog is constantly itching at that time, showing alopecia in the inner thighs with skin discoloration and a bilateral symmetrical pattern. And a heart murmur was present and was leaking urine when she was happy most of the time. The timeline of this dog, we have a lot of vaccines here, and this dog was vaccinated a lot. As you can see, started in March 2015 with the worming, the DHAPP, and Bordetella vaccine, then the worming, and the DHAPP IL2, then the Giardia vaccine, the worming again, the front line, because we have a lot of troubles with ticks and fleas here. And then the front line was routinely applied. again was vaccinated, and rabies vaccine as well. The patient in September 21st, 2015 had her first heat cycle, and she ran away, and that's when the owner didn't want the pregnancy process to continue because she knew this dog had a heart trouble. So she decided, according to the vet recommendation, apply the hormonal injection, as I told you before, and 2 doses were applied subcutaneously at 24 hours apart, and a dose of Metacam was given due to the pain in the site of application. So this was September 21st, and October 5th, 2015, this dog became very itchy and had eczema, especially on the dorsum area. And the treatment was frontline and a dose of synthetic omegas, human brand. We don't know what kind of brand they gave, and deworming because maybe they found fleas. In October 10, 2015, another consultation was given because the dog was still itchy and was developing ear discharges. The treatment was chlorhexidine, which is a treatment made of chlorhexidine. A treatment an ointment treatment in the inside of the ear canal, some antibiotics, and that's it at that time for this dog. In October 19, the dog developed a swollen and hard mammary gland after I told you the application of the hormonal treatment. And as I told you before, it can be applied, this treatment, in the dorsal area, but one of the side effects is the change of the hair color. So another site for the application of this treatment is the inner thighs. So maybe that application was too close to the mammary gland, and that mammary gland developed a really massive inflammation, and that treatment was Metacam at that time. They decided to do some test, the blood count and skin scrape test, and all was within normal range. In December 17, started thinking about maybe a allergic reaction and switch to another kibble, and the skin improved a little bit. In May 14, 2016, that's when I saw for the first time in the clinic, and it was related with an allopathic consultation. At that time, I was finishing the AVH course. So the patient arrived very anxious, and the owner didn't know why. After several questions, this owner remembered that Reina ate some plants the day before while she was doing some floral bouquets, and the patient vomited once. So what we saw in the physical exam, this patient was really anxious. The pupils were dilated and fixed, presented tachycardia. The pulse was fast and superficial. So we decided to put in the dark room this patient prior hospitalization, and this patient was not that tachy and anxious. So that's when belladonna was given and IV fluids. Only one single dose of belladonna resolved this problem, and the next day went home this dog. Uh, and we didn't hear about this dog in May, but in June, the owner repeated belladonna 30C because she saw the dog acting in the same manner than the previous episode. She did not contact me, and she just gave the remedy, and took 3 hours uh, to see some changes and improvements. And the owner didn't tell me about it until I saw her for the constitutional treatment. In June 14, another veterinarian found pain in the lumbar region and was resolved with meloxicam at that time. So when I saw Reina for the constitutional treatment, what I found was in the skin, eczema on the dorsum area, brown spots on chest and ventral abdomen and around the vulva, a lot of itchiness, the dribbling micturition in the urinary, obviously in the urinary system. The respiratory system was normal. In the cardiovascular system was tachycardia and a heart murmur 5/6. Um, the mucous membranes were normal. The digestive tract was normal. I could see a stomach discharge and some black spots in the inner canty, and was not hair around that area. The body score was 3/5 at that time, and no tests were done. So the allopathic diagnosis was valvular cardiomyopathy, an allergic dermatitis, and a hormonal disturbance or imbalance. I did 2 homeopathic workups, and obviously it was an outburst of her chronic disease, and the dribbling urine and the heart murmur were present probably since birth. And the itchiness and the skin problems obviously maybe were aggravated by the hormones applied. For me, an obstacle to cure was the diet. She was with chemo, and the prognosis was good. The homeopathic symptom list: the heart murmur, the dribbling urination, the itching skin, the skin eruptions, the darker skin around the vulva, the inner thighs and the lower abdomen, the eczema, the mama was swollen. And I did 2 analyses, Bonninghausen and Kent. And at that time, those were the rubrics I found or related mostly with this case for me. So chest, heart and region off, urine micturition, urination involuntary, skin and exterior body, itching in general, skin and exterior body, eruptions, scabby with crusts. Skin and exterior body spots, like brown liver color, like cloasma. Not really accurate, but that's what I chose at that time. Skin and exterior body tethers in general, and chest mama swelling. And the main remedies were lycopodium, mercurius, sulfur, conium maculatum, pulsatilla, sepia, calcarea, graphitis, silica, bryonia, phosphorus. And the other repertorization Mostly found the same remedies. I could see another ones like arsenic, carbobage, lachesis, sepia. So for me at the time, I could relate these three remedies: lycopodium, sepia, and calcarea carbonica. What we can see in lycopodium related with this case, we can see the involuntary urination, the heartburning nodosities in breast with stitching and aching pain and soreness, aneurysm, hydropericardium, the dry skin, uh, the skin becomes thick and indurated. We can see some brown spot and freckles, the long-lasting incontinence of urine, the violent itching, the chronic eczema, the skin becomes thick and indurated, the palpitation and turning over in bed at night, hydropericardium, and lies upon right side, and hypertrophy of heart. What we can see in the other remedy like sepia, it is that sepia has bedwetting, the bladder is weak, we can see hormonal imbalances as well, the weakness in small of the back, the breast swollen, they are never well since the hormone pills, the cloasma, the spots on the skin, the breast swollen, the induration of the breast, the venous stasis, the congestion of the blood vessels, dropsy in consequence of valvular insufficiency, palpitations with anxiety, ailments from the birth control pill, and the hormone and with hormonal creams or patches as well. This remedy acts mostly on the portal system with venous congestion. We can see involuntary urine as well during the first sleep. Circulation is irregular, dropsy in consequence of valvular insufficiency, ichthyosis, and offensive odor of skin. The skin blotched, raw, rough, hard, or cracked. We can see brown or claret colored tetter-like spots. And calcarea carbonica is the other remedy. And we can see breast tender and swollen before menses, hot swelling breast, severe stitches in breast, weakness of heart, needle rash, milk white spots, boils, chilblains. We can find in this remedy retention or involuntary urination, mammary glands pain as if suppurated, especially when touched. The breasts are hard but not red, petechial eruptions, boils, chilblains with heart palpitation from the slightest effort, fatty degeneration and calcification of blood vessels as well, aneurysma, especially of the aorta. So, my allopathic mind chose, obviously, sepia. And I gave a very conservative dose of 30C remedy. And that was June 8th, 2016, when I gave this remedy. And I saw this dog 2 months later. At that time, this owner was having troubles with her husband. She was dealing with his cancer, so I didn't see her very often, and I didn't have many phone reports, or I couldn't be able to speak with her very often. So I saw her 1 month later, and Reina was improving almost all the symptoms, including mine because she was more alert and bright, following orders easier. The owner commented that after the remedy was given, she was calmer the first day, and the next day was much more happier and active. But we, we could see, or I could see in the physical exam, no changes with the heart murmur. The dribbling urination was better, according to the owner, was 50% better. The skin symptoms, the itching, the skin eruptions were around 50% better as well. And there was no more eruptions, and the old ones were healing. The darker skin around the vulva and the inner thighs and the lower abdomen around 30% clearer. The eczema and the mama, the swelling of the mama was 50% better, and no more eczema was uh, presented. Okay. Hmm. Okay, that was August, and I saw during September, and according to the owner, she saw a wonderful recovery. The skin was healthier, not itchy, the hair was growing, and the owner was happy so far. So as you can see, the improvements in the skin were around 80%, and the swelling around the mama was 80%, and there was no pain. In the heart murmur, there was no changes. In the dribbling urination, it was around the same, 50%. That was during September 9. Okay, September 25th, the owner decided to reduce sepia because she saw more micturition after coming back from vacations. Maybe due to the stress in the boarding facility, and she decided to reduce the remedy. I saw her in October 18, 2016, and this dog looks normal, but the heart and the urination are not resolved. So I was thinking if I should change the remedy or I should stay with this one. So I didn't see the owner until January 10, 2017. And this dog was doing great. And again, that dribbling urination was not resolved, but improved. At that time, the heart murmur, I thought, okay, this is deep pathology. Maybe homeopathy cannot do anything to this dog. So I don't know what should be my expectancy about the heart troubles at that time. And for me, the main problem was the diet. And that's what I saw at that time. The itching was really good, the skin troubles and the darker skin was not present, and the swelling of the mama was not present either. But still, the heart murmur and the dribbling urination were an issue. So that was January, and in May 2017, we saw ticks, more itchiness, eruptions, dry skin again, ear discharges, acrid lacrimation, and the hair was again dry and losing her, this dog, especially in the dorsum area. So some blood tests were done and no interesting things were found. Because we have a high rickettsial troubles with many dogs. So we did the SNAP4DX and was negative, and I did a second repertorization. And I did heart, chest murmurs, cardiac murmurs, chest murmurs, cardiac murmurs, valvular, the ear discharge, the skin, hair falling out, the skin and exterior body, dry eruptions, the swelling of the mamma, the micturition, involuntary urination, the eyes with lacrimation, and I added the dwarfishness in this dog, which I thought it was related with a heart murmur. So at that time, I found that I could think in another remedies as well. So obviously, I decided not to keep going with sepia, and other contenders were still lycopodium, calcarea carbonica, phosphorus, and silica terra. In phosphorus, we can find enlargement of the mammary gland, suppuration of the breast, dilation of the heart from fatty degeneration and endocarditis, palpitations, weak heart, burning in skin with restlessness, brownish or blood red spots, constant discharge of thin, slimy, colorless fluids from the urethra, cancer of breast, sharp, lancinated pain, or bleeding easily, inflamed indurations, very painful, heart dilated, especially the right from fatty degeneration or following endocarditis, congestion of blood to heart, excited by sensual impressions. The wounds bleed very much, even if they are small wounds. They heal and break out again. Involuntary urination, hematuria, or bladder full, but urine doesn't flow. In silica terra, what we can find is nightly incontinence after a blow upon the head, frequent urination with tenesmus, heart trouble from nervous exhaustion, throbbing all over the body, violent hammering palpitation after every quick or violent motion. Um, um, what else? Sorry, throbbing all over the body, violent hammering palpitation after every quick or violent motion, unhealthy skin, every injury separates, pilons, abscesses, old scars, ulcers, impetigo, breast, heart, swollen, cirrhosis with itching, heart lumps, breast cancer. Um, we can find a continuous urging and scanty discharge of urine, urgent at night, desire to urinate without emission, urination followed by involuntary discharge of urine, throbbing all over the body while sitting, orgasm of blood at night, throbbing in vessels, heart troubles from nervous exhaustion, accumulated eruptions, carbuncles, painful pustular eruptions, or keloid growths. So my second prescription in May 14 was Calcarea carbonica 30C. Again, very conservative. Uh, again, I couldn't have any reports from the owner at that time. So I saw the remedy on May 14, and I could see this owner until August 23rd, 2017. So 2.5 months later. And the owner mentioned Reina had improvement like a miracle with this remedy. She looked much more active and happier. The skin was normal, the hair was growing again, the physical exam showed ticks again, the skin was dry and itchy, the ears with discharge, but not as much as the last time, and obviously the heart murmur was still present. So I redosed Calcarea carbonica 30C one dose, and I had no reports at that time. So that was August, and on December 2017, some more people was around the house for the holidays, and the owner asked for a phone consultation because Reina had an ear discharge and she was not active as usual and fainted that day. She was very active with all the people around her and suddenly fainted, as I told you. And she could see her tongue was purple. She took Reina to a closest veterinary clinic, and when she arrived, the dog was fine, and no treatment was done at that time. So I only recommended redosed Calcarea carbonica, and finally an appointment for the cardiological examination uh, was. I mean, she wanted, but she had no time to do it because all the problems she had with her husband at that time. So she decided to go with the cardiological examination. And before that happened, this dog went out and find another boyfriend and made it again. Sorry. Hmm. Okay. So another dose of the same treatment was given with another veterinarian. She didn't came to me because she was afraid or in panic about the heart trouble, and that could cause another trouble with this dog in the pregnancy. So in March 30th, 2018, I saw her again. She tells me about the hormonal injection. So we decided to perform an ultrasound to see if there was a pregnancy process going on or not, and the uterus was not occupied at that time. So I was exploring the LM potencies, and I switched to Calcarea carbonica LM1, 5 drops every 48 hours to this dog. And please report every other day. And as usual, I didn't have any reports. And until May 15, 2018, I saw her again. The skin problems, the ear discharge had improvement. And I moved this dog to 5 drops dissolved in water and report every other day. Obviously, I didn't have any feedback. And I saw this dog until July because Okay, at the time, Reina was doing fine. She was bright, very active. No aggravation were noticed by the owner. No air discharge, no skin problems. And obviously the heart murmurs were still present. We saw ticks again, and I was very shy about the prescription with the LM potencies, just added 2 drops and 10 succussions or shakes at that time, and report every other day or when necessary. So again, that was July 2018. I saw this dog until September. She was doing fine, an annual checkup and blood test within normal range. And Reina on November 10, 2018, fainted, and the cardiologic consultation was advised again, and finally was programmed for the next month. Again, still remained with Calcarea carbonica LM1 once daily. And on December 15, what we could find uh, many changes in the heart, compatible with the tetralogy of Fallot. So it was not a valvular disorder, only one valvular disorder. It was the tetralogy of Fallot. So it was a shock for me because it was my very first cardiological patient, my very first patient with LM potencies. It was my first patient with tetralogy of Fallot as well. So I was happy what was going on with this patient. In January, the Holter monitor was placed 24 hours to measure the cardiac rhythm, and the tests show partial right branch blockage, paroxysmal sinus tachycardia, sinus arrhythmia, and sinus blockage, which are not associated with the syncopes. The heart rate was 135/180 beats per minute during motion, and the highest rate was 215 beats per minute, and 95 beats per minute during rest. In February, Reina was still doing great. Ticks were present. They added like a color for ticks and fleas, and I still remain with Calcarea carbonica LM1, and that was at February 15, 2019. In April 30th, 2019, another cardiologic and homeopathic consultation was done, and there were no changes in the cardiological examination. The patient was very well compensated. So at that point, remained the treatment the same. During 2020, I saw this dog very few times because uh, we were not close to this owner. The clinic, we changed the clinic very far from them. So we could only talk with by phone. So I sent LM2 and LM3 in 2020. In June 30th, we have a trouble with Reina, and we could see her, but almost dying. I only could give phosphorus at that time, but she didn't make it, and she finally died. This dog was doing fine for over 4 years with homeopathy and very conservative treatment, and any allopathic medication was given, and with a very profound and deep pathology. And I was very happy for that. I will show you some videos in 2019. As you can see, it's a very active dog, running, playing with a ball, not fainting, very good muscle mass, and not panting. She had in this video some acrid discharge in the eyes, but the skin was overall very well. And this is the third video. So as you can see, it's a pretty healthy dog. I was reviewing the case today in the morning, and I was thinking that I could be much more accurate in my rubrics and maybe much more refined with the treatment, and I could use calcarea phosphorica or some other remedies, but uh, even though it could be a partial remedy, this dog had a great life for almost 5 years. So I was very happy for that. Thank you.
All right. Great case. Thank you. Thank you so much, Rosie. Everyone's
Thank you.
unmuted. So if anyone has any questions or comments, now is a great time to discuss this great case. How old was she when she passed, Rosie?
5 years old.
5 years.
Yeah, so the expectancy for tetralogy of
Yeah.
allowed dogs, it's 1.5 years old.
Yeah. Yeah.
So yeah, the cardiological veterinarian was really impressed how this dog was doing without medication. And even though my treatment was really conservative, this dog was doing really well.
It, Sue, anything you want to ask about the postology or anything at all?
I think it's a great case, Rosie, and
Yeah.
I just it would have been fun to see what would have happened if the cardiologist hadn't scared the heck out of everybody with the big scary diagnosis, you know.
I know, and I was very naive. I didn't know what to expect. I didn't know. Yeah, yeah, I didn't know anything much more. Probably I would be in fear or
Yeah, exactly.
refuse the case, or I don't know.
Yeah, we could muddle along as long as we don't know what's going,
Yeah,
going on.
yeah,
I was looking at I was looking at a couple of things with the dog. I the the second time she had that fainting or syncope or
yeah.
collapse or whatever we're going to call that thing,
Hmm.
they talked about it being from noise, and I looked there's a rubric. I didn't chase hard, but there is a faintness from noise,
Yeah,
it's a really small rubric. But interesting, like it's interesting that lycopodium's in that rubric,
yeah.
and that was one of the um, the rule outs on your original repertorization,
Hmm.
and antimonium crudum's there, asafoetida, borax, lycopodium, mercurius, and natrum muriaticum.
Yeah,
It's interesting that modality was there, and I didn't look at any other noise aggravates.
yeah, yeah. I
But
didn't add any mentals or fears, or I just put pathology at that time. And yeah, I could be more refined in my repertorization, of course, but for sure. But yeah, that's
well, I'd
how
be
we
sort of
went. Yeah,
scared to rock the boat anyway,
yeah, yeah, yeah. And yeah, I'm so happy. I gave some
It's
more
a great
years
case.
to this dog.
Yeah, it's a great case. It's just a
Yeah,
really great case. It's amazing that
yeah,
bodies can do.
yeah. Thank you.
So, Sue, do you feel that had the cardiologist not said anything, or if there was no diagnosis, that it would affect the dog's lifespan?
No, I think we as clinicians tend to um, consciously or unconsciously bias ourselves with, like, oh my God, I'm treating this big scary thing that usually, dies when it's 8 months old, or, those kinds of things, and
Yeah.
that we also have a I don't know. I think a non-conscious bias for the potential for big change in some of these really serious pathologies. And
No.
I think of some cases over the years that have been like that, and some human cases that I've read, and it's all, it's that game about, not saying, I'm not saying that the diagnostics shouldn't have been done, but it's just like, it's like, well, holy man, now what? Yeah.
Yeah. Yeah.
Mm.
What is in front of me?
Yeah. Yeah, I mean, I think we stumble along. I was talking to a colleague the other week about a dog that had a huge mass in his chest, and was treated for, was diagnosed elsewhere with laryngeal paralysis, and treated that
Yeah.
way for ages and ages and ages and ages and ages, and then went into homeopathic care, and then was diagnosed with this gigantuous mediastinal mass, and the dog did really well for probably the better part of 2 years. I'm not very good at the linear time all the time, but did really well for a long time. But it was the same sort of thing, as I imagine how big your eyes got, Rosie, when you saw
Yeah.
that report. It was, I mean, the eyes got really big
Oh my
when
God.
this clinician saw the report with this. I mean, this mass was like as big as a house inside this dog's chest.
Yeah.
Yeah.
Yeah. Yeah. And obviously, but but even though it could be a partial remedy, uh, what we can do for them.
Oh my, yeah. Yeah.
Yeah.
Right.
Yeah.
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 Absolutely. That's the thing, and I think that it's always nice to just sort of be able to cast aside our biases and say, well, yeah, that's a big scary diagnosis, but let's just follow the case and see what see what they can do. And the
Yeah.
dog looked really, that didn't look like an ailing pup at all,
Yeah. And when you see cases like this, and you don't know what you are treating at first, uh, you feel much more confident when you see more cases, even though you don't have the allopathic diagnosis or
Yeah,
the yeah, and
yeah,
and and you start to become much more confident about your
Mm.
prescription and about how you are treating a dog.
yeah. And also, I think about the phenomenal ability of bodies to respond.
Yeah,
And I think so long, like we're not. I don't think there's anybody in the room here with us tonight that our training in veterinary school uh, doesn't really have a lot of confidence that the body's able to respond, like that innate vitality and that self-organizing principle that we know bodies have, and that's that sort of thing. And I think this case is a really amazing testament to
yeah,
that,
yeah,
yeah.
yeah, and because of this case, uh, just I started to see much more cardiac cases, and now, yeah, I have many of them, and I feel much more I feel much more confident treating them.
Yeah,
So, yeah,
I've had some. I don't have the radiographs with me here. They're in Pennsylvania, but dogs with really big cardiac enlargement. Lots of sternal contact. That sort of stuff. And those hearts went back to normal. Within normal parameters. Picked themselves back off the sternum. The big murmurs, went away, or went down to half a degree out of 6. It's really interesting to watch those things happen. You think you're losing your mind, actually.
yeah, yeah. I have another case. I will show you a video. Let me see if I have it here. This is a King Charles Spaniel, and this dog is swimming, and right now it's 14 years old. Any allopathic treatment, doing great, and taking,
Really?
yeah,
You should
and
show Larry Bernstein that.
yeah, and this dog is really well. So yeah,
And these guys are the poster child for cardiovascular
Mhm.
abnormalities.
yeah, yeah, and yeah. Obviously, this dog was dying at 6 years old. Yeah, and came to me around 10, and so I've been treating this dog for around 3-4 years, and he's doing great.
Yeah.
Even yeah, and he's swimming.
Well, it doesn't have that frailty that we often see in those elderly calves either.
Yeah, yeah. So that's the case.
And Rosie, how was her vitality right before she died?
What was, sorry, Jeff?
Was she active? Did she just all of a sudden pass
Yeah,
away?
it was how is it called in English? Heat stroke.
Oh,
And yeah, I think it started with a heat stroke, but we don't really know.
Wow.
Yeah.
Wow.
hmm But not related with the heart trouble. So yeah, it 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 it, yeah, it went really well this case for me, even
Yeah.
though
Great.
I was very conservative of the remedy prescription and the owner ability to talk and all the problems she had around the house with her husband and things like that.
Yep.
it's that's what I thought was really nice about it is that there there wasn't really any follow up. I mean, like if it that you just sat loose to that this is what was going on in the lady's life. You weren't going to get any more follow up than that. We'll just sort of puddle along as best we can with that.
Yeah.
And I was thinking about some of the cases that I've heard in the past. A lot of times a lot of times from the Indian homeopaths, just because of geography and the way people's lives are and that sort of stuff, you know, where we treat really seriously ill individuals and like no follow-up, no, like, you know, months and months and months of no follow-up, and you know, they do well.
Yeah.
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 Maybe it keeps us out of interference.
Yeah. Yeah. Sometimes it's our own bias or own. Yeah, we want to know more about the case.
Mm.
Yeah.
Yeah, and maybe that hurriedness or that kind of behavior we could have with cases could alter that piece of the case.
Yeah.
Yeah. So thanks a lot.
Okay, and one comment, one question. Ila, you have your hand raised. Have a question for Rosie, or?
First of all, Rosie, it was a really great presentation. I'm just wondering, like when you did consult with cardiologist, what did he say? Like did he mention any allopathic medicine on top of it, or he was just done like, oh my God, what a diagnosis? And so like I'm just curious, like what he said about this case.
Oh, of course, he wanted to start with allopathic medication, but he was,
Okay, okay, yeah, that's
of
what I was
course,
wondering. And
yeah,
okay,
but dog was doing really well. So
yeah,
yeah.
great.
So
I'm
after every single cardiological consultation, he was like, "Oh my God, this
yeah,
dog is doing well. He's doing well. She's doing
yeah,
well. She's doing well. She's doing well." So yeah,
yeah. Okay, thank you.
thank you. Good to hear from you, Ila.
It's been a long time. We'll catch up sometime.
Yeah.
Yeah, great
Uh,
presentation.
Thank you.
And Jane had a great case. Jane, do you want to share your case? Which really speaks to the ability of the body to heal.
It really is no more than what I mentioned in the comment. I might have to run here. We're having a thunderstorm and my dog's starting to freak out. But this was like 25 or 30 years ago. This lady, and this was a phone consultation case. She called me, her dog had been diagnosed with a cardiac hemangiosarcoma and at the vet school in Tennessee. And I sent her a remedy and she went back for a recheck some weeks later and the mass was gone. They couldn't find it. They had and they said that they must have misdiagnosed it.
Of course.
Mhm.
And
Yeah.
I don't think we even told them about the treatment, which is too bad, really.
Yeah.
Yeah. But the owner and you know the truth.
Right.
Yeah.
And that was, you know, you talk about getting the confidence, you know, that kind of thing gets you the confidence. But this was a great case for that in particular, an amazing first sick case, you know, that's fantastic. And it took me 15 years after graduating from vet school and doing homeopathy to be fearless about it because of all the brain damage from vet school I had to get over.
Yeah. I know.
Okay. Anything else from anyone else? Nope. Then just want to say thank you again, Rosie. This was great. What a great case. And we'll see everyone next month.
Thank you, guys.
Thanks, Rosie. Stay safe.
Bye bye.